Hello everyone, my name is David Diaz and welcome to my oral presentation on gonorrhea. Gonorrhea presentation. Gonorrhea. Gonorrhea is an STI caused by the bacteria Neisseria gonorrhoeae or gonococcus. It is mainly found in the discharge from the penis and vaginal fluid. The bacteria infects the cervix, urethra, and the rectum, and in some rare cases, the throat or eyes. Contraction of gonorrhea. Gonorrhea passes from person to person. Contraction can happen through unprotected oral, anal, or vaginal sex. It can even be contracted through the eyes. People with numerous sexual partners or those who don't use a condom are at greatest risk of infection. The best protection against infection are abstinence, monogamy, sex with only one partner, and proper condom usage. Behaviors that make a person more likely to engage in unprotected sex also increases the likelihood of infection. These behaviors include alcohol abuse and illegal drug abuse, particularly intravenous drug use. In this image, you see a gonococcal urethritis. It's eye infection of the gonorrhea bacteria. Signs and symptoms of gonorrhea. Men may not develop noticeable symptoms for several weeks. Some men may never develop symptoms. Typically, the infection begins to show symptoms a week after its transmission. The first notable symptom in men is often a burning or painful sensation during urination. As it progresses, other symptoms may include greater frequency or urgency of urination, a pus-like discharge or drip from the penis, white, yellow, beige, or greenish, swelling or redness at the opening of the penis, swelling or pain in the testicles, a persistent sore throat. The infection will stay in the body for a few weeks after the symptoms have been treated. In rare instances, gonorrhea can continue to cause damage to the body, specifically the urethra and the testicles. Pain may also spread to the rectum. In this image, you see an example of oral gonorrhea. In this slide, you see an example of genital gonorrhea for the male and female. Signs and symptoms of gonorrhea. Many women don't develop an overt symptom of gonorrhea. When women do develop symptoms, they tend to be mild or similar to other infections, making them more difficult to identify. Gonorrhea infections can appear much like common vaginal yeast or bacterial infections. Symptoms include discharge from the vagina, watery, creamy, or slightly green. Pain or burning sensation while urinating. They need to urinate more frequently. Heavier periods or spotting. Sore throat. Pain upon engaging in sexual intercourse. Sharp pain in the lower abdomen or fever. Diagnosis of gonorrhea. Healthcare professionals can diagnose gonorrhea infection in several ways. They can take a sample of fluid from the symptomatic area with a swab and place it on a glass slide. The areas include penis, vagina, rectum, or throat. If your doctor suspects a joint or blood infection, he or she will obtain the sample by drawing blood or inserting a needle into the symptomatic joint to withdraw fluid. They will then add a stain to the sample and examine it under a microscope. If cells react to the stain, you most likely have a gonorrhea infection. This method is relatively quick and easy, but it doesn't provide absolutely certainty. This test may also be completed by a lab technologist. A second method involves taking the same type of sample and placing it on a special dish. This will be incubated under ideal growth conditions for several days. A colony of gonorrhea bacteria will grow if gonorrhea is present. A preliminary result may be ready within 24 hours. A final result will take up to 3 days. Treatment for gonorrhea. Modern antibiotics can cure most gonorrhea infections. Most states also provide free diagnosis and treatment at a state-sponsored health clinic. Gonorrhea is usually treated with an antibiotic injection of ceftriaxone one time to the buttocks, or a single dose of erythromycin by mouth. Once on antibiotics, you should feel relief within days. The law requires healthcare professionals to report the infection, usually to the county public health department. Public health officials will identify, contact, test, and treat any sexual partners of the affected person to help prevent the spread of infection. Health officials will also contact the other people these individuals may have had sexual contact with. The emergence of antibiotic-resistant strains of gonorrhea is a growing challenge trusted source. These cases may require more extensive treatment, with a 7-day course of an oral antibiotic or dual therapy with 2 different antibiotics, usually for a total of 7 days of therapy. The antibiotics used for extended therapy are usually given once or twice a day. Some common antibiotics used include our erythromycin or doxycycline. Scientists are working to develop vaccines to prevent gonorrhea infection. Prevention of gonorrhea. The safest way to prevent gonorrhea or other STDs is through abstinence. If you do engage in sex, always use a condom. It's important to be open with your sexual partners, get regular STD testing, and find out if they've been tested. If your partner is showing signs of a possible infection, avoid any sexual contact with them. Ask them to seek medical attention to rule out any possible infection that can be passed on. You're at a higher risk of contracting gonorrhea if you've already had it or any other STDs. You're also at a higher risk if you've had multiple sexual partners or a new partner. In conclusion, gonorrhea is a sexually transmitted disease, also known as STD. It's caused by infection with the bacterium Neisseria gonorrhoeae. It tends to infect warm, moist areas of the body, including the urethra, the eyes, the throat, the vagina, the anus, and the female reproductive tract. Gonorrhea is transmitted from person to person through unprotected oral, anal, or vaginal sex. People with numerous sexual partners or those who don't use a condom are at greatest risk of infection. Best protections against infection are abstinence and monogamy, or sex with only one partner, and proper condom usage. The end. And this concludes my oral presentation on gonorrhea. I hope you enjoyed it. Thank you for watching.